Good evening, everybody, and thank you guys for tuning in. Tonight, we'll be having a 50 question CNA practice test. So, these are some things that you'll want to know in order to pass your CNA test. So, hello, future CNAs. Welcome to Florida Training Academy's official YouTube channel, where we will help you pass your exam, gain confidence, and start your healthcare career strong. In today's video, we're going over 50 must-know CNA questions designed to test your knowledge, sharpen your skills, and boost your confidence for the big day. Whether you're just starting as a CNA or if you're getting ready to retest, this review session is perfect for you guys. Good evening, everybody in the comment section. So if you guys haven't done so already, be sure to like, share, and subscribe at www.fltraining.com. So getting ready for your practice test. Yes, this is live. We want to build your confidence. So before we begin, find a quiet space to focus. Have a notebook or scratch paper ready. Read every question carefully and trust your instincts. You already have the heart for patient care. All right, so I'll give you guys a few seconds to grab your pen, paper, whatever you need, and then we'll go ahead and get started. I see some returning people in the comment section. I see some new faces as well. So thank you guys so much for taking your time out this evening. I have been waiting a long time for this. Well, thank you for joining in, guys. All right, well, let's go ahead and kick it off. So question number 1. A patient complains of sudden chest pain and shortness of breath. What should a CNA do first? A, offer water to calm the patient. B, leave the room to find the nurse. C, stay with the patient and call for immediate help. Or D, reassure the patient that it's likely indigestion. Diana, congratulations on passing your exam and your written test and your skills test. Great job with that. Wendy, this is a live feed here, so thank you for attending. OSHA has different procedures. Okay. All right, you guys, I'll give you 3 more seconds to go ahead and answer. In 3, 2, and 1. The correct answer is going to be C. This could indicate life-threatening condition like a heart attack or pulmonary embolism. Staying with the patient while calling for help ensures safety. So great job there. Question number 2. Which of the following is a CNA's responsibility when caring for a patient with a nasogastric tube? A, administering medications through the NG tube. B, monitoring for signs of discomfort or dislodgement. C, flushing the tube with saline. Or D, adjusting the feeding rate. So you guys remember what your scope of practice is. It's important to understand that before answering the questions. I'll give you guys a few seconds to answer that. I see a comment. Someone says that they need help. Can you specify what you're needing help on? All right, in 3, 2, and 1. The correct answer is B. CNAs do not administer medications or flush NG tubes, but they can observe for issues like dislodgement or discomfort. So good job with that one, you guys. Question number 3. The heart is located in which body cavity? A, the abdominal cavity. B, the cranial cavity. C, the thoracic cavity. Or D, the pelvic cavity. Give you guys 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is C, the thoracic cavity. This cavity houses the heart and the lungs. So if you guys didn't know that, be sure to jot that down so you'll know for future references. Checking out the comment section here. Excuse me. I need help to pass my CNA. I failed twice already. Be sure to watch these videos, do the review sessions, and then also go online to the website at www.flcareeracademy.com or www.floridacareeracademy.com. There are some resources on there, and then you can also go to www.fltraining.com. There's so many different resources on there. And then if you have any questions about anything with that other than asking me during this live feed, you can email. It's admin@fltraining.com for questions. But yes, please be sure to use all those resources because there's a ton out there to help you prepare for your success. All right, you guys, question number 4. Which of the following body systems is primarily responsible for producing hormones? A, the digestive system, B, the muscular system, C, the respiratory system, or D, the endocrine system? Give you guys about 3 more seconds to fill that. All right, in 3, 2, and 1. The correct answer is D. The endocrine system regulates hormones affecting various bodily functions. All right, next question here. Question number 5. A patient with dementia is trying to leave the facility, believing they need to pick up their child from school. What is the best response? A, lock the door and leave them in. B, firmly tell them they cannot leave. C, redirect the patient to another activity. Or D, call the police. Give you guys about 3 more seconds here. Let's see. Going through the comments again. Said you email without a response. Okay, go ahead and email today, and then I will get in touch with someone to reach back out to you. Sorry for the delay on that. All right, you guys, let's go ahead and reveal this answer. So the correct answer is C. Redirection is a common technique in dementia care to reduce agitation. Question number 6. Which is a sign of depression in elderly patients? A, increased social activity, B, enhanced appetite, C, excessive laughter, or D, withdrawal from activities? Give you guys about 3 seconds to answer this one. In 3, 2, and 1. Correct answer is D. Excellent job there. Depression often leads to withdrawal and loss of interest in activities. Someone asks if we go live every day. There's usually not a live stream every day, like every 7 days of the week. But if you subscribe to the channel, you will get notifications whenever there is a live stream going on. Question number 7. When should a CNA perform hand hygiene? A, only after patient care. B, before and after patient care. C, only when hands look dirty. Or D, after using the restroom. Viridina, congratulations on passing your exam. Give you guys about 3 seconds here to answer. In 3, 2, and 1. The correct answer is B. Hand hygiene is critical before and after patient contact to prevent the spread of infection. So you guys know the number one way to prevent the spread of infection is hand hygiene. So you want to be making sure that you're doing that before and after patient contact. Question number 8. Which of the following is considered a standard precaution? A. Wearing gloves for all patient contact. B. Isolating all patients with a fever. C. Washing hands before and after glove use. Or D. Using masks for every patient. Give you guys about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is C. Hand washing is a universal standard precaution. Gloves are used when exposure to bodily fluids is possible. So you guys know with the standard precaution, going back to the options, so washing hands before and after glove use. So that was an example of that one. Question number 9. When lifting a heavy object, a CNA should A. Bend at the knees and keep the object close to the body. B. Keep the feet together and use back muscles. C. Bend at the waist and lift quickly. Or D. Hold the object at arm's length. Give you guys about 5 seconds to answer this one. All right, we'll go ahead and reveal the answer. The correct answer is A. Excellent job in the comment section. Proper lifting techniques prevent injury by using leg muscles, not the back. So we want to save our back and we want to use our big muscles and our legs to lift heavy objects. Question number 10. When transferring a patient from bed to a wheelchair, which of the following is the most important? A. Locking the bed wheels. B. Using a gait belt for support. C. Placing the wheelchair far from the bed. Or D. Telling the patient to move quickly. Nellie, congratulations. I see a lot of people are passing, so you guys are doing very good, and I'm very proud of you. Keep up the good work. I'll reveal the answer in 3 seconds. In 3, 2, and 1. The correct answer is B. A gait belt provides support and safety during transfers. All right, let's go to the next one. Next question is number 11. How often should perineal care be provided for an incontinent patient? So we have two big words here. We have perineal care and incontinence. So you guys make sure you know your medical terminology, because if you don't understand the terminology, it will be very difficult to answer the question. So option A, after every episode of incontinence. B, once a day. C, only if there is an odor. Or D, twice a week. Someone said they used the wrong email for the practice test. I recommend that you reaching out to admin@floridafltraining.com. Let me put this in the chat so you can see it. Okay. All right, let's reveal this answer. The correct answer is A. Frequent perineal care prevents skin breakdown and infection. And then, let's see, someone asked about something on question 10. Why not A for number 10? Let's go back. So question number 10 asks, when transferring a patient from a bed to a wheelchair, which is the following is most important? Locking the bed wheels, using a gait belt for support, or placing the wheelchair far from the bed, or telling the patient to move quickly? The correct answer was B. A gait belt provides support and safety during transfer. So with this, which with these questions and with all these kind of questions, even NCLEX, CNA exam, phlebotomy, all these different ones, it's always what is the best answer. So with that one, I would think the gate belt, locking the bed is very important, but most of the time the bed is locked, or sometimes the bed is like not movable. So it's already sitting, it's fixed in that area. So using the gate belt, when you're getting the patient up, you're trying to move them, so it gives you something to grab on. A is also a correct answer, but it's asking what is the most important. So that's how that breaks down, which it can be very difficult, but that's why we give you guys these kind of questions, because these are the style that you'll have whenever you have your testing. Great question there, though. All right, we are on question number 12. When assisting a patient with oral care, which of the following patients require special attention to prevent aspiration? A patient with dentures. B, a patient with dry mouth. C, a patient who is alert and mobile. Or D, a patient who is unconscious. All right, I will reveal the answer in 3 seconds. In three, two, and correct answer is D. Unconscious patients cannot protect their airway, increasing the risk of aspirations. Great job there, you guys. Okay, question 13. Which of the following vital signs would be considered abnormal for a 45-year-old adult at rest? A, the pulse is 84, respirations are 18, blood pressure is 118 over 78, temperature is 98.4 degree Fahrenheit. B, the pulse is 102, respiration is 22, blood pressure 132 over 86, temperature is 100.2 degree Fahrenheit. C, the pulse is 60, respirations are 14, blood pressure 120 over 80, temperature is 98.6 degree Fahrenheit. D, pulse 76, respiration 16, blood pressure 110 over 70, temperature 97.8 degree Fahrenheit. So it wants to know what's abnormal at rest for a 45-year-old. Give you guys a few seconds to write these down. All right, in three, two, and one. The correct answer is B. Excellent job there, you guys. So pulse over 100 beats per minute is tachycardia. Respirations over 20 is tachypnea. And a temperature over 100 are all considered abnormal. While the blood pressure is slightly elevated, it's the combination of all the signs that indicate potential illness or distress. So you want to look at your patient as a whole. And you guys, please be sure that you know your normal values, because if you don't, then you won't know what to report that's abnormal. So that will be good to know on paper for your test, but in person too, because you need to be able to report these abnormalities to the nurse. Question number 14. Which of the following is an example of a biohazard? A used tissue. B, a patient's food tray. C, a soiled dressing. Or D, a clean pair of gloves. I'll reveal the answer in 5 seconds. In 5, 4, 3, 2, and 1. Correct answer C. Good job there. Soiled dressings contain bodily fluids and are considered biohazard. So you guys be sure that you put these items in the biohazard container. Somebody in the chat tell me what color the biohazard container is. And be sure that you're not putting things that don't belong in the biohazard container in there, because one, they pick that up and they're charged by the weight of it. Red, good job, Chrissy. Thank you so much for that. And two, you want to make sure that you're putting things in the proper receptacle. So good job with that, you guys. Yes, red, biohazard is always red. All right, question 15. While assisting a patient after ambulation, the CNA notes a blood pressure of 88 over 56. The mmHg, you guys, that's for millimeters of mercury. That's what your blood pressure is measured in. And the patient appears pale but says they feel fine. What should the CNA do while waiting for the nurse to arrive? A, sit the patient down and elevate their legs. B, offer water and return the patient to the bed. C, assist the patient in walking more to improve circulation. Or D, take the blood pressure again while standing. Yes, someone mentioned the biohazard is red or white with the red symbol. So it's usually red, or it may be the red biohazard symbol on there, but it's always red on there all the time. Like sometimes you may see the lid of it's white, or it has like a big red with a white around it. But yes, you will definitely see a biohazard symbol on there. All right, in 3, 2, and 1, let's reveal that answer. The correct answer is A. Excellent job, my smart friends. A blood pressure of 88 over 56 is low, which is known as hypotension. Remember, hypo, low. And the pallor may indicate poor circulation. Elevating the legs promotes blood flow back to the heart. Offering fluids is appropriate later, but not the first course of action. Walking or standing further could cause fainting. Question 16. Which of the following is a violation of patient confidentiality? A, taking a photo with a visible patient in the background. B, posting about your workday on social media and mentioning a patient's condition. C, discussing a patient's diagnosis with another staff member in the hallway. Or D, leaving a chart open where visitors can see it. Or E, all of the above. I'll give you guys 3 seconds for this one because I know you guys know this one. And 3, let's see the chat fill up. 2, and 1. Yes, correct. E, all those were violations of confidentiality. Even unattended exposure, like having a patient in the background of a photo or discussing care in a public space, can be a HIPAA violation. Patient privacy must always be protected, especially in the age of social media. And I want you guys to know HIPAA is very serious. You can be fined and you can go to jail for a HIPAA violation. So always think it's a need to know basis. If they don't need to know, if they need to know, you tell them. If they don't need to know, they don't. And on top of that, make sure that you are in a private area when you're telling them, and it should always just be for the people involved in their care. Question 17. Which approach is appropriate when communicating with a patient who has autism spectrum disorder, also known as ASD? A, stand close and maintain strong eye contact to show attentiveness. B, use simple, direct language and allow extra time for responses. C, speak quickly to keep the conversation moving. Or D, use playful teasing to build rapport. I'll give you guys about 5 seconds to answer this. All right, we'll reveal the answer. Correct answer is B. People with autism often respond best to clear, simple communication and may need more time to process what's being said. Avoiding overstimulation and giving space can help them feel safe. Strong eye contact and fast speech may be overwhelming or misinterpreted. Question number 18. Which statement best explains the difference between being mute and being nonverbal? A, mute means the patient has no vocal cords. Nonverbal means they whisper. B, mute means the patient chooses not to speak. Nonverbal patients are ignoring you. C, mute refers to inability to speak due to physical or psychological reasons, while nonverbal includes individuals who may use gestures, pictures, or devices to communicate. Or D, there's no difference between the term. I'll give you guys about 5 seconds to answer this one. In 5, 4, 3, 2, and 1. Correct answer is C. Great job there, guys. Being mute is typically linked to a physical or psychological condition that prevents speech. Being nonverbal means a person does not use spoken language but may still communicate effectively using alternative methods. CNAs should learn to recognize and respect these differences. Question 19. Which of the following is most important when feeding a patient who is at risk for aspiration? A, feeding the patient while they are lying flat. B, offering large spoonfuls to speed up the process. C, giving thin liquids with a straw. Or D, positioning the patient in an upright position. So, like I've told you guys before, when I take my test, I always think about these things. Like I create a visual in my head, and I'm like, okay, yeah, that doesn't look right, or absolutely, like that's the correct option. So, be sure you're thinking your answers through before answering them. And let's reveal this answer. The correct answer is D. Upright positioning helps prevent fluids or foods from entering the airway. Thin liquids and straws can increase aspiration risk, and patients should never be fed while lying flat. Question number 20. Which of the following best describes range of motion exercises? A, they're exercises that strengthen the heart. B, they're activities that help maintain joint mobility. C, they're exercises to build muscle mass. Or D, they're mental exercises to help improve memory. Give you guys a few more seconds to answer this in 3, 2, and 1. The correct answer is B. Range of motion exercises prevent joint stiffness and promote mobility and flexibility. So we want to help prevent contractures, which is when the joints stiffen up so much that they're not able to move. So we want to promote flexibility. Question 21. A patient's blood pressure is recorded as 180 over 110 millimeter of mercury. What should the CNA do? A, record it and wait for the next scheduled check. B, immediately report it to the nurse. C, ask the patient if they feel okay and do nothing. Or D, recheck an hour before reporting. I know you guys know this answer too, so I'm going to give you 3 seconds to answer in 3, 2, and 1. Of course, it is B. This is a hypertensive crisis and requires immediate attention. Good job, you guys. Question 22. Which of the following is the normal range for an adult's pulse? A, 50 to 60 beats per minute. B, 50 to 80 beats per minute. C, 50 to 120 beats per minute. Or D, 60 to 100 beats a minute. I know you guys know this because I know you guys know your normal values, and you guys are flooding the chat. Love to see it. Let's reveal the answer in 3, 2, and 1. D, the normal adult pulse rate is between 60 and 100. Excellent job there, you guys. Question 23. Which patient is most likely to require a high-calorie, high-protein diet? A patient with a broken arm who is walking independently. B, a patient who is obese and trying to lose weight. C, a patient recovering from a major surgery or burn. Or D, a patient on bed rest for day 1. I'll give you guys about 5 seconds to answer this one. This one's a little bit more difficult. So put on your thinking caps, and I know you guys will answer it correctly. In 5, 4, 3, 2, and 1. Correct answer is C. Patients healing from burns or surgeries need extra calories and protein to support tissue repair and energy needs. The body uses more nutrients during this healing process. Good job there, you guys. And please be sure, if you don't know that answer, if you're learning something new, write it down so you know for next time. So here is where we have the free CNA training videos on YouTube. If you guys follow this page, be sure to like, share, and subscribe. There is so much content on here to help you all succeed. Question 24. When a patient who is at risk for aspiration, when feeding a patient who is at risk for aspiration, which position is most appropriate? A, high Fowler's, which is 90 degrees. B, semi-Fowler's, which is 30 degrees. C, supine. Or D, side lying. Give you guys about 3 seconds to answer this one. In 3, 2, and 1. The correct answer is A. We froze up for a minute. Sorry about that. High Fowler's position prevents aspiration by keeping the airway open during feeding. Let's see. Someone asked, where's the link on that video? The link is going to that website. Let's see, I'll put it here in the chat so you guys can all check it out if you haven't done so already. All right. Question 25. We're halfway there, guys. A patient has been on bed rest for several days. Which complication is the CNA most concerned about? A, dehydration. B, contractures. C, hypothermia. Or D, loss of appetite. No problem. All right. I'll go ahead and reveal this answer in 3, 2, and 1. The correct answer is B. Good job there, you guys. Immobility can lead to contractures which restrict movement. So we want to make sure that we're doing those range of motion exercises if the doctor has indicated that that's okay. Question 26. What is the primary function of the trachea? A, to absorb oxygen into the bloodstream. B, to carry food from the mouth to the stomach. C, to carry air from the throat to the lungs. Or D, to filter waste from the blood. So another thing I do, like if I see a question's asking about a trachea, I instantly am like, okay, where is this at on my body? So I touch it, and I'm just more of a hands-on person. So what's the function of the trachea? In my head, I'd be thinking, where's the trachea first off? Second, now what does the trachea do? I'll give you guys 3 seconds to answer that in 3, 2, and 1. Correct answer is C. The trachea or the windpipe is part of the respiratory system. You guys know the respiratory system helps us breathe. It serves as a passageway that carries air from the pharynx, which is the throat, to the bronchi and into the lungs. It is not a part of the digestive system or the urinary system. So just to show you guys, put my camera on. Trachea right in here. All right. Question number 27. Which of the following organs is responsible for filtering waste from the blood? A, lungs, B, liver, C, kidneys, or D, pancreas? You guys, 5 seconds to answer this. So if you haven't realized, knowing your terms, knowing your anatomy, those things will get you far. In 3, 2, and 1, let's reveal this answer. The correct answer is C. The kidneys filter waste and excess fluids from the blood, forming urine. Somebody else in the chat helped me out. So this was about maybe a month ago. We talked about if the patient is not able to filter the waste on their own and they're in kidney failure, what's something that you guys may see that they have to do to get rid of that waste? Starts with a D. While you guys are thinking about that answer, I'm going to go to the next question, question 28. Somebody help me out. I know you guys know this. Dialysis, yes. Good job, Chrissy. Good job, you guys. Dialysis, for sure. All right, question 28. What is the main purpose of the pancreas in the body? A, to store urine. B, to filter toxins out the blood. C, to control the heartbeat. Or D, to produce insulin and aid in digestion. So what's the pancreas do? Give you guys 5 seconds for that one. In 5, 4, 3, 2, and 1. Correct answer is D. Excellent job. The pancreas is a vital organ that produces insulin, which helps regulate blood sugar, and also secretes digestive enzymes that help break down food in the small intestines. And it plays roles in both the endocrine and the digestive system. Question 29. A patient with anxiety begins to breathe rapidly and says that they feel faint. What should the CNA do first? So this is a priority question. A, encourage slow, deep breathing. B, call for the doctor immediately. C, leave the room to find help. Or D, tell the patient to calm down. Give you guys 3 seconds for this because I know you guys know how to prioritize. In 3, 2, and 1. The correct answer is A. This one was a little difficult. We want to do deep breathing techniques because they can help reduce hyperventilation and anxiety. I've seen a few people select B. So what are we going to do first? So the key word here, the patient, they have anxiety and they're breathing rapidly and saying that they feel faint. So they may be having an anxiety attack. The key word here is that they have anxiety. So that's already been established. So we want to try to get them to calm down. So, I always tell them, deep breathe with me. Let's go in through the nose and out through the mouth. Sometimes I say, smell the roses and blow out the candle. So they take big, deep breath in, and that kind of helps relax the nervous system. All right. Question 30. Which of the following PPE, which is personal protective equipment, is required when caring for a patient with C. difficile? A, gloves only. B, gloves and gown. C, gloves, gown, and mask. Or D, no PPE is needed. Yeah, it's about 5 seconds for this one. In 5, 4, 3, 2, and 1. The correct answer is B. Contact precautions, including gown and gloves, are necessary for C. diff due to the risk of contamination. So in other places, you guys may see it as contact precautions, or you may see it as contact plus. Where I work at, we call it contact plus. So can we use hand sanitizer if a patient has C. diff? Yes or no? Somebody let me know. Can we use hand sanitizer? I'm looking in the chat. No. Good job, Chrissy. Because you guys remember, and Miriam and Naomi, thank you guys so much for the feedback, and Catherine as well. If we use the hand sanitizer, then we're going to just keep coating it because remember, it's a spore. So it's just like coating it like MM. You're just putting more and more coating on there. So you have to wash your hands with soap and water. You have to use the friction to remove that. So say that I'm the nurse taking care of patient A in room 211. I take care of them. They're having a lot of diarrhea. I'm washing them up or getting them clean. I use hand sanitizer. So then I go to patient B in the next room and I'm carrying that with me because I never removed the spores from my hands. So please be sure to wash your hands with C. diff. Good job, you guys. All right, question 31. What is the primary purpose of an indwelling urinary catheter? A, to deliver medication to the bloodstream. B, to provide nutrition directly to the stomach. C, to monitor liver activity. Or D, to drain urine from the bladder. So what's the purpose of a urinary catheter that's indwelling? Give you guys 5 seconds for this one in 5, 4, 3, 2, and 1. Correct answer is D, to drain urine from the bladder. A indwelling urinary, also known as a Foley catheter, is a thin, flexible tube that stays in place to continuously drain urine. It's commonly used for patients who are immobile or undergoing surgery. Question 32. When moving a patient up in bed, the CNA should instruct the patient to A, cross their arms over their chest and bend their knees. B, keep their legs straight and stiff. C, grab the bed rails for support. Or D, hold their breath during movement. Anybody else acting these things out as you're reading them? Because I am. That's what I do. That's how I learn. And it works for me. You just have to find what works for you and just go with it. Some people need to just read it. Some people need to imagine it. I use all those different sources for myself. All right, here we go in 3, 2, and 1. Correct answer is A, crossing the arms and bending the knees to provide better leverage and safety during reposition. Let's see, someone says, can you please answer question 30 for me? I thought we were supposed to wear a mask for C. diff because we can't breathe in toxins. So yes, C. diff is contact precautions. So C. diff is not droplet and it's not airborne. It's contact. If it was droplet or airborne, you would wear a mask because it would be going through the air or by droplet. You have to actually physically touch the spore in order to transmit the disease. So it's contact precaution for that one. So that's why you only have to wear the gown and gloves for that one. So anything respiratory or airborne, you're going to wear a mask. All right, question 33. A CNA is pushing a wheelchair to maintain proper body mechanics. The CNA should A, keep their arms straight and locked. B, lean forward while pushing. C, stand upright and use leg muscles to push. Or D, use one hand for steering and the other for pushing. We'll answer this in 5 seconds in 5, 4, 3, 2, and 1. Correct answer C, using leg muscles and maintaining proper posture prevents straining and injury. Question 34. What is the correct term for listening to internal body sounds with a stethoscope? A, percussion. B, auscultation. C, palpation. Or D, observation. Big words here. Makes you feel all fancy using these big medical terms, doesn't it? All right. And we'll reveal the answer in 5 seconds. So 5, 4, 3, 2, and 1. The Correct answer is B, auscultation. So auscultation is the act of listening to sounds within the body, such as the heart, lungs, intestines, often using a stethoscope. Percussion involves tapping, and palpation involves feeling with the hands. So one way for you guys to remember that, like if you can say, I'm auscultating. Auscultating is the same thing, but that's the verb form of it. Auscultate a blood pressure. So that's a skill for you guys. So that's listening to the blood pressure. Question 35. Which of the following procedures is used to remove fluid from around the lungs? A, thoracentesis, B, paracentesis, C, lumbar puncture, or D, endoscopy? You have 5 seconds to answer this one in 5, 4, 3, 2, and 1. The correct answer is A, thoracentesis. Thoracentesis is a procedure in which a needle is inserted into the pleural space to remove excess fluid. Paracentesis removes abdominal fluid, and a lumbar puncture is used for spinal fluid. So those are the difference between those. 36. What is the primary purpose of a colostomy? So you guys remember your prefixes and your suffixes. So if you don't know what this word is, you kind of break it apart to figure it out. A, to remove kidney stones. B, to bypass the stomach. C, to create an opening for urine to leave the body. Or D, to create an opening for stool to leave the body. 5 seconds to answer this one in 5, 4, 3, 2, and 1. Correct answer is D. This photo to the left depicts a picture of a colostomy. So a colostomy is a surgical procedure where a portion of the colon is diverted into an opening in the abdominal wall to allow for stool passage. Question 37. What is the term for low oxygen levels in the blood? A, hypotension. B, hyperglycemia. C, hypoxia. Or D, hypothermia. So looking at these options, all 4 of them, 3 of the 4, hypo means low. You guys know that. Hyper means high. So if it's asking for low levels using your process of elimination, you already have 3 answer choices now because we know one of them isn't appropriate. So use your thinking like that whenever you're looking at the answer choices. All right, in 3, 2, 1. The correct answer is C, hypoxia. Hypoxia refers to low oxygen levels in the blood, which can lead to confusion, shortness of breath, or even organ damage if untreated. Question 38. Which of the following actions violates a patient's right to privacy? A, closing the curtain before providing care. B, discussing a patient's condition with unauthorized individuals. C, documenting care provided in the patient's chart. Or D, allowing the patient to decide their daily schedule. So it's asking which one is a violation of privacy. 3 seconds here. In 3, 2, and 1. Correct answer is B, discussing a patient's private information with anyone not involved in their care is a violation of confidentiality. 39. Which of the following is a basic CNA level intervention for a patient with COPD, also known as chronic obstructive pulmonary disease? A, administer oxygen therapy. B, encourage slow, deep breathing and elevate the head of the bed. C, prescribe a bronchodilator. Or D, suction the airway. Scope of practice here question, you guys. What is within the scope of a CNA? Give you guys 3 more seconds to answer this in 3, 2, and 1. Correct answer is B. Great job there. CNAs can help improve breathing by elevating the head of the bed and encouraging relaxation. Oxygen administration and suction require a licensed nurse. Remember, you guys, oxygen is a medication, so you have to be a nurse to administer. Question 40. Which diet is most appropriate for a patient with gastroesophageal reflux disease? A. High-fat spicy foods. B. Regular diet with extra fluids. C. A bland puree diet. Or D. Low-acid bland foods with small frequent meals. Give you guys 5 seconds to answer this one. You got to think through this one. So think about what GERD is. And then think about what would help a patient with GERD. All right, 5, 4, 3, 2, and 1. Correct answer is D. Low acid bland foods with small frequent meals. So GERD patients should avoid acidic, spicy, and fatty foods. Small meals reduce the pressure on the stomach. A puree diet will only be needed if the patient was at risk for aspiration. Excuse me. Question 41. What is the function of a bedside commode? A, to collect stool and urine specimens at one time. B, to allow urination in a lying position. C, to be used for patients on complete bed rest so they do not have to walk to the bathroom. Or D, to help patients void safely when they cannot walk to the bathroom. About 3 more seconds for this one. And 3, 2, and correct answer is D, to help patients void safely when they cannot walk to the bathroom. A bedside commode is portable and helps prevent falls when patients are weak or recovering. A bedpan should be used for a patient on complete bed rest. Question 42. When assisting a patient with ambulation using a cane, the CNA should ensure the cane is held in A, the hand on the weak side, B, the hand on the strong side, C, both hands for better balance, or D, the hand closest to the wall. So in your head, imagine what a cane is first, what it looks like, and then think about how you're going to use it, which would help the patient be more stable. Give you guys 5 seconds for this one. So 5, 4, 3, 2, and 1. The correct answer is B. The cane should be held on the strong side to provide support for the weaker side. So always remember it goes on the strong side. I don't know if you guys like the movie Remember the Titans, but they're like left side, strong side. Think of that and think of me saying that and you'll remember it every time. All right, question 43. A patient is unable to dress themselves. What should the CNA do first? A, allow the patient to choose their clothes. B, dress the patient without asking. C, leave the patient alone to try dressing. Or D, only assist with socks and shoes. We have about 5 seconds to answer this one. 5, 4, 3, 2, and the correct answer is A. Respecting the patient's independence and preferences promotes dignity and autonomy. Question 44. What does the term osteoporosis refer to? A muscle disease causing weakness. B, a loss of bone density. C, inflammation of the joints, or D, a curvature of the spine? Give you guys about 5 seconds to answer that one. 5, 4, 3, 2, 1. The correct answer is B, a loss of bone density. So osteo means bone and porosis means porous. This condition makes bones weak and more likely to fracture. Question 45. What is the best item to offer a diabetic patient who is shaky and weak, sweating? A, diet soda, B, cheese and crackers, C, orange juice, or D, sugar-free pudding? You guys about 3 seconds to answer this. In 3, 2, and 1. The correct answer is C, orange juice. These are symptoms of hypoglycemia. A fast-acting sugar like juice can raise blood sugar quickly. Question 46. Which of the following best describes isolation precautions? A, separating all elderly patients from others. B, wearing PPE like gloves to prevent the spread of airborne infections. C, only isolating patients with visible wounds. Or D, using special precautions to prevent the spread of infection. Give you guys 5 seconds to answer this one. In 5, 4, 3, 2, and 1. The correct answer is D. Excellent job there. Using special precautions to prevent the spread of infection. Isolation precautions are infection control practices used in healthcare to prevent the transmission of infectious diseases from one person to another. These include hand hygiene, wearing PPE, using dedicated equipment, and limiting patient transport. Isolation precautions cover all types of infections, such as contact, droplet, and airborne, and include multiple strategies like gowns, masks, dedicated equipment, and patient placement, not just gloves. Question 47. A patient with a weak immune system is placed on neutropenic precautions. 1 second. Okay, sorry about that. I had a cough. What should the CNA do? A, put on full PPE. B, avoid bringing in fresh flowers or unwashed fruits. C, provide a high-fat diet. Or D, use airborne precautions. Give you guys about 5 seconds to answer this one. So remember, the patient has a weak immune system, and our key word here is neutropenic precautions. Let's reveal the answer in 3, 2, and 1. The correct answer is B, avoid bringing fresh flowers or unwashed fruits. So neutropenic patients are at high risk for infection. So bacteria on plants or raw food can be harmful. Remember this, we would use this precaution with people who need reverse isolation. That's another word you may hear from. So we want to make sure we're not getting these patients sick or bringing anything into them that could cause them illness. Question 48. Which of the following is the best example of a phishing attempt that a CNA should avoid? A, an email from your supervisor with your schedule attached. B, a text message asking you to click a link to verify your employee login. C, a password protected facility policy sent through the official intranet. Or D, a handwritten note from the nurse about a patient update. So it's asking about phishing. Give you guys about 5 seconds to answer this in 5, 4, 3, 2, and 1. Des passed her exam. Congratulations, everybody. Tell everybody congratulations. There has been a lot of success. I like to see the feedback. A lot of you guys are passing, so great job and keep up the good work. All right, let's reveal this answer. The correct answer is B, a text message asking you to click a link or verify your employee login. Phishing is a scam where attackers try to trick you into giving up sensitive information. Messages from unknown sources with suspicious links are red flags. Always verify requests through official channels. 49. You are assisting a resident who confides that they feel depressed and are thinking about not waking up tomorrow. What is the most appropriate action for the CNA to take? A, sit with the resident and promise to keep their secret. B, tell the resident to focus on the positive and ignore the comment. C, listen respectfully and immediately report the statement to the nurse. Or D, call the resident's family and let them know. All right, let's reveal this answer in 3 seconds. In 3, 2, and 1. The correct answer is C. We want to listen respectfully and immediately report the statement to the nurse. The CNA scope of practice includes observing, reporting, and documenting, not diagnosing or treating. Any statement suggesting self-harm or emotional distress must be taken seriously and reported promptly to a licensed nurse or supervisor for appropriate intervention. Our last question here, question number 50. You are assigned to help multiple residents with vital signs. You notice the blood pressure cuff has a visible residue on it after use with a resident who has MRSA or methicillin-resistant Staphylococcus aureus. What should you do next? A, wipe the cuff on your uniform before using it on the next resident. B, use the cuff on the next resident and clean it afterwards. C, ignore it because MRSA is only dangerous to nurses. Or D, clean and disinfect the cuff immediately before reusing it. Give you guys 5 seconds to answer this one in 5, 4, 3, 2, and 1. The correct answer is D. Clean and disinfect the cuff immediately before reusing it. MRSA is a highly contagious infection. All shared equipment must be cleaned before being used again, especially when visibly soiled. This helps prevent the spread of infection between patients, which is a key responsibility of CNAs under standard precautions. So here is a link if you need any additional study resources. Excuse me, here's a link there. If you guys click on those, that should take you to the site. I'll leave this up for a few seconds. And if you want to watch our free training videos, you can go to www.youtube.com/Florida Training. And you can register for a course at www.fltraining.com. Also, you can download your free study guide at www.nurseunits.com. And we want you to pass your exam with our free resources. So always remember that caring CNAs become caring nurses. And if you haven't done so already, be sure to comment, like, share, and subscribe. And thank you so much for joining us this evening. I'm sure Nurse Eunice will be on sometime this week, so be sure to set up the notifications there so it will let you guys know. I am Nurse Jackie, and I plan on being with you guys next Monday evening again. And thank you so much. You guys have a blessed week. Good luck to everyone who's taking their exam. this week, and I hope you guys have the best time. And I'll see you guys next week. You guys take care. See ya.